figures for cervical cancer are startling. In a global meeting on cervical cancer prevention in Malaysia, experts did not mince words.
Almost 300,000 women die every year. This total could double by 2030.
90% of the cervical cancer deaths occur in developing countries.
Every year, 530,000 cases of cervical cancer among women, and of which 134,000, to be precise, are in my country, India.
For particular countries, the statistics are alarming with each passing year. According to the Global Cervical Cancer Crisis card by the Guttmacher Institute, Africa is the worst place to be a woman with cervical cancer. Top 10 out of 50 countries with highest mortality or death rates are in the continent. Uganda takes number 4, losing 34 women per every 100,000 to a rather highly preventable disease. The crisis card looks at the inequalities amongst regions as something that could be increasing the disease as well as the deaths.
If you're a girl growing up in my hometown of New York City, where cervical cancer rates are very low, you will get access to an HPV vaccine. If you're a girl growing up in a country in Africa or in Asia or Latin America, you are most likely not to get access, where rates are the highest.
At the Global Forum on Cervical Cancer Prevention, experts said they want the history of the disease changed.
Every girl in the world should have access to HPV vaccines. Every woman should have access to screening and treatment when appropriate.
Faith Buckley from the Gavi Alliance gives hope to many girls and women in low-income countries. Inexpensive HPV vaccines.
The challenge is how do we get vaccines to the places that need it the most? And we've heard a lot of statistics, but let's remind everybody that there's 3 issues going on in these countries. So you have a higher incidence of HPV infection, you have late screening, and you have worst outcome. So they have a triple whammy.
The vaccine, as high as $13 a dose, has now been reduced to less than $5 in 73 Gavi countries. That is from 33,000 shillings to about 11,000 shillings. Kenya is the first country to start piloting under Gavi funds. Rwanda has rolled out the vaccine nationally, and Uganda, with help from the Gardasil vaccine maker Merck, will cover 140,000 girls until a national rollout on the Gavi-funded vaccines in 2014.
For every 1,000 girls who get the HPV vaccine, 13 lives are saved.
We expect that by 2020, 30 million girls will be immunized in over 40 countries.
All this is to be enforced with good political will, which Zambia's First Lady, also a gynecologist, doubts.
There are a lot of myths that are still going on amongst policymakers, and I think, even as we started talking about cancer of the cervix in Zambia, many people questioned why I was calling for investment in cervical cancer when people were dying from malaria, when people were dying from HIV.
Jill Sheffield, the founder of Women Deliver, an organization concerned with improving the health and well-being of girls and women, is worried that this is where a mistake has been made for long. Each country owes its woman a healthy life. That is something that the Malaysian government is taking seriously, and other health experts are saying that other countries should borrow a leaf from Malaysia.
For us in Uganda, we should really say sorry to ourselves, because Malaysia, we are told that 40 years ago, was exactly the same with us.
Malaysia has been offering for free cervical cancer, the HPV vaccine, to any young girl who wants to have it. Imagine.
Over 95% of eligible girls have received all 3 doses of the vaccine. We have started a catch-up campaign to provide the HPV vaccine to college-going women. All of our girls and young women deserve the chance to have a future free of cervical cancer.
The older women have also not been forgotten in this fight.
The pap smear test is made available free to all women between the ages of 20 and 65 once every 3 years.
Uganda, like many low-income countries, faces challenges such as human resource, health workers who can't tell whether a woman has cervical cancer, and women who never go to health facilities. Experts say the disease needs to be confronted with vigor.
We need to have focal desks in the Ministry of Health that is strongly working on cancer of the cervix in the country. And we need to divide that program into that desk officer should be very cognizant of prevention and treatment.
Survivor Genevieve Sambi, a Malaysian model, speaks of her experience.
If I can get through it, then there are other ladies out there who can get through it.
Global Health Strategies also wants to fight inaccurate information, which brings out negativity about the vaccines.
They cover about 70 to 80% of the strains that cause cancer. Few or no one can argue about the safety.
David Gold, the principal of Global Health Strategies, is convinced that this woman killer will almost get eliminated.
The question is not if, the question is when.
Florence, NTV.